Hello there, my name is Dr. Jones. Very good to see you today. Please do make yourself nice and comfortable there. Now then, I do believe you are booked in for a cranial nerve exam today, is that correct? Okay, very good, very good. I think we'll just jump right into it. If you're okay with that, I will explain everything as we go. Basically, I'm just going to need you to follow the instructions that I give you today, and I'm going to be making some observations of you as you carry out the simple tasks that I ask you to carry out today. Okay, it should be very easy, should be quite fun, possibly even relaxing as well. Okay, if you do need a break at any point, just let me know, but otherwise I think we'll crack right on with it, and I'm just going to put my gloves on to begin with. Okay, first things first, I need you to look at my nose. Okay, just stare at my nose, and what I'm going to do is I'm going to grab my light and I'm going to shine it in your eyes, okay? So just continue to look at my nose, and for the time being, completely ignore the light, okay? Do not be distracted by the light. Don't be distracted by anything, in fact. Focus your attention 100% on my nose. Okay, 100% focus is required of you right now. Please look at my nose and nowhere else. Okay, what I'm doing is I'm just observing your eyes, your pupils, the dilation, and also the whites of your eyes as well. Okay, see how they behave, see how they react to the light in various different positions, and also I'm just having a general look at your eyes as well. Okay, can get a little basic understanding of your eye health just by observing them like this. Okay, that's actually very good. Well done there. The next thing I need you to do is now I need you to follow the light with your eyes, but I want you to keep your head perfectly still. Okay, perfectly still, kind of like a statue. And as the light moves around, you move your eyes and your eyes alone to follow the light, okay, as it moves around. Does that make sense? Yes, very good, exactly like you're doing now. Just follow the light with your eyes as it moves, okay? It will get quite bright at times, but that's because it's a light, okay? And when you shine light directly in the eyes, it gets quite bright. That's quite scientific, that is, obviously. You needn't worry yourself about the science behind it. All you need to do is to follow the light with your eyes, okay? Now then, as you're carrying this out, are you experiencing any pain at all? Experiencing any pain? Any discomfort at all? Discomfort? No. Any headaches? Any headaches? Perhaps when the light gets particularly bright, any headaches? No. Okay, that's a very good sign indeed. Very good sign indeed. Well done so far, well done so far. Now then, the next thing I need you to do is I need you to blink when I click my fingers. Okay, so if you could please blink, 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 eyes on my nose, and I'm going to move my fingers in various different directions like this, and I need you to tell me when they leave your field of vision, but all the time you're staring at my nose, okay? So, let's do that now. Let's begin the peripheral vision test. Tell me when you can no longer see my fingers. Good. 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 I'm going to take a step away from you and we do the same test, okay? So tell me when you can no longer see my fingers. Good. 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 Okay, very good. It looks like the range of your peripheral vision is satisfactory. Okay, it's good. It's within the normal range. Okay. Now, the next thing I'm going to do with you is the finger wiggle test. The finger wiggle test. This is still utilizing your peripheral vision, so if you don't mind, please continue to look at my nose. Focus exclusively on my nose. Don't look anywhere else. Don't look anywhere else. Ignore what's going on in your peripheral vision. Just look at my nose. Look at my nose. Look at my nose. Look at my nose. Okay. Now, what I'm going to do is I'm going to wiggle one of my fingers, or both of them, maybe both of them. I might change the location as well of where they wiggle, things like that. And I need you to tell me which finger is wiggling, left, right, or both, all the time whilst looking at my nose, okay? Understand? Very good, okay. Now then, let's begin. Left or right? Good. Left or right? Good. Both, very good, excellent. Continuing the test. Good. 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 Okay, that's enough. Excellently well performed there. Well performed indeed. That's a good sign. Good sign so far. Now then, next I'm going to need to utilize a tongue depressor, but I'm not actually going to be depressing your tongue with it, okay? I'll show you what I mean in just a minute. Now then, I have the tongue depressor. Of course, that is the professional medical terminology for it. You might think of it as a lollipop stick. Okay, lollipop stick. What I'm going to do is I'm going to place this against your nose. Okay, a bit strange, isn't it? Placing it against the nose. Why would I be doing that? No. Okay, placing it against your nose, just holding it somewhere like that, something like that. And what I'm going to do, I'm going to use a pencil. I'm going to tap different locations on the tongue depressor. And I want you to focus your eyes on the specific point where the pencil tip taps the tongue depressor. Okay, I think it's quite straightforward. Okay, let's try that now. Okay, focus your eyes here. Focus your eyes. Very good. Focus your eyes here. Very good. Focus your eyes here. Very good indeed, okay. Focus your eyes here. Marvelous job. Focus your eyes here. Okay, very good. I'm going to change the angle slightly, so I can get a little bit closer, a little bit further away. Okay. Focus your eyes here for me, please, okay? Focus your eyes here. Very good indeed, okay. Focus your eyes here. Excellent. Let's go here. Focus your eyes here, please. Focus your eyes here. Excellent job, very excellent. Okay, all the way back here. Can you focus your eyes here for me, please? Okay, marvelous. One last one. Can you focus your eyes here for me, please? Very good job. Very good job indeed. Marvellous, marvellous. Okay, I'll throw that in the bin now. That's all done. Well done, well done. Okay, now going back to utilising the light. What I want you to do is I actually want you to focus on my finger over here. Okay, can you see my finger wiggling there? Yes, well done. Focus on the finger wiggling. Do not look at the light, please. Do not look at the light. Keep focusing on my finger wiggling. Okay, keep focusing on my finger wiggling. Focus on my finger wiggling. Wiggling finger. Focusing on the wiggling finger. Wiggling finger. Keep focusing on the wiggling finger. Okay. Now we're going to go to the other side. Focus your eyes on this wiggling finger now. Okay. This wiggling finger. And ignore the light. Ignore the light, please. The light is not important. The finger wiggling finger is important instead. Okay. I'm just making some observations. Don't mind what I'm doing. You focus instead on the wiggling finger. On the wiggling finger. That's the top priority now. It's priority number one. Priority number one for you is to focus on the wiggling finger. I'm just looking at your eyes. Okay. Okay, very good. Interesting observations there that I just made. Right. What I want you to do, I want you to close your eyes for me, please. Okay? No cheating. No opening your eyes. Don't peek a little bit. Don't peek a little bit. Close your eyes firmly for me, please. Okay? This is a test. But if you cheat on this test, you're only cheating yourself. Okay? Because it's a medical examination. Of course. Of course. Okay? Now then. Your eyes are still closed. Keep them closed until I tell you. What I'm going to do is I'm going to pass the light over your eyelids as they're closed. And you should be able to identify for me when a light is passing over your eyelids, okay? So please tell me when the light is passing over your eyelids. Just say now. Good. 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 Okay, you can open your eyes now. That was well done. You are correctly identified every single time it passed over your eyelids. Okay, marvellous. Now, the next thing I'm going to do is I'm going to cover your eyes with my hand. Okay, a little bit different this time. And I'm going to count down from 5 to 1. Then I'm going to remove my hand and you're going to be finding yourself staring at a light. Okay, it's going to be quite intense and quite bright. But it is necessary for me to make some observations. Okay, so 5, 4, 3, 2, 1. Okay, focus on the light with your eyes. Focus on the light with your eyes. Okay, we do it again. 5, 4, 3, 2, 1. Okay, focus on that light. Focus on the light with your eyes. Focus on the light with your eyes. Okay, very good. I like what I see there. Well done. That was quite an intense and slightly difficult test, I think, for the eyes. Quite a strain to go from pitch black to blazing light in your eyes. Okay, take a minute if you want to, blink your eyes, feel a little bit better about your situation. Okay, let's see now. What should I be doing next? Okay. I see. Going to be looking at your peripheral vision once again, looking at my nose. Now looking at my nose, I'm going to hold up a number of fingers. A number of fingers in various different places, okay? Various different places. In your peripheral vision, you're looking at my nose the entire time, and I want you to tell me how many fingers total am I holding up. Okay, so let's begin. Okay, that was 4. Very good. 5. Very good indeed. 3. Excellent job. 2. Marvelous. Then just moving the position of the position. 5. 10. eyes? No, it's not. Silly me. I forgot the most crucial element of testing your eyes, and that is of course the eye chart. Okay, which we will be doing that now. Okay, now then we have here the eye chart. Classic. Mr. Snellen made this, I believe. Snellen chart, Mr. Snellen. Okay, renowned eye man, eye doctor, optician, whatever you may wish to call him. Mr. Snellen. Both eyes open. Can you tell me what? What is that letter, please? That is an E. Very good. Off to a good start, this one. Good. Last line for you, is it? A little bit difficult. Okay, that's absolutely fine. Could you cover one of your eyes now for me, please? And I'm just going to point at a couple of random letters, not the whole chart again. That would be too boring. Okay, so this one. Good. Okay. Now if you could cover the opposite eye for me, please. Do the same thing. Random letters. Good. Okay, excellent. And now, with both your eyes uncovered, please, can you tell me what is this colour? That's a green. Very good. Okay, and what is this colour? Absolutely marvellous. That's red. Okay, these little circles on the side here, this is more for my reference. You know, I can place the chart against your eyes and measure the size of your pupils, see which one they line up with. Okay, that's more for my personal use, but you know, I'm such a good doctor, such a professional, that I don't really need that anymore. I've seen thousands of eyes, thousands of pupils, and I know the sizes of my head. Okay, now then, well done with the Snellen chart. Well done indeed. Excellent vision. Let's move on, shall we, to your face and your muscles and your nerves in the facial area. Okay, what I'm going to do now, I need to touch your face. Okay, is it okay for me to touch your face? Yes, very good. This is a medical exam, of course, so I need to do things like this. I'm just going to be poking your face in various little places. It might seem a bit unusual, might seem a bit pointless and stupid. What am I doing? I'm just touching your face in random places, but little do you know. Okay, I can tell merely by touching your face the quality of your nerves and your musculature, your facial musculature. Oh my goodness, absolutely marvellous. Marvellous facial musculature that you have here. Absolutely phenomenal. Looks like you have some good response to the nerves as I'm pressing them as well. Very good reflexes indeed. Okay, that's what I would expect to see from an examination of the face. Now then, what I want to do is something called the sharp or the soft test, and for this I'm going to utilize my pencil because I've got it close by and it is a suitable tool. What I'm going to do is I'm going to get you to close your eyes for me, and I'm going to poke you in the face, either with the pencil, the nib of the pencil, or the is not really sharp. Obviously it's just pointed. But you get the gist. Okay, one will feel sharp, one will feel soft. If you could close your eyes for me now, please. Very good. And I'm just going to randomly poke you in the face. Was that sharp or was that soft? Excellent. Was that sharp or was that soft? Very good. Sharp or soft? Very good. Sharp or soft? Good. Sharp or soft? Good. Last one. Sharp or soft? Very good. Okay, you can open your eyes now. Very good. Very good indeed. Excellent job there. Let's see what yes. The facial expression portion of the cranial nerve exam. This is quite unusual, quite perhaps silly. You could describe it as silly. I need you to make a series of bizarre facial expressions for me. First of all, I want you to puff out your cheeks as hard as you can, okay? So something like this. Okay, do that for me. Excellent, marvelous, okay. Now I need you to grit your teeth and grin as hard as you can for me, something like that. Okay, absolutely excellent. Now I need you to frown for me, please. Okay, I want to see those eyebrows absolutely furrowed. Okay, so do that for me as best you can. Marvelous job. Okay, and now I need you to be surprised. Okay, I need to see those eyebrows as high as they possibly can go. Okay, very good. Is there something I'm missing? Ah, yes, of course. I need you to flare your nostrils. As much as you can for me, please. Think of yourself as a gorilla with mighty big nostrils. Flare the gorilla nostrils for me. That's right, perfect. Okay, excellent. That might seem like I'm taking the mickey, taking the piss, okay, but I'm not. That's an essential part of the cranial nerve exam. It's to see if you have control over your facial muscles and your facial nerves in particular. Okay, so very well done there, excellent job. And the next thing I need you to do is I'm going to place my hand against the side of your face, just like that, okay, and I need you to press your head against it. I'm going to be applying a little bit of force, okay, so turn your head and press against it. Okay, very good. Now then, this side as well, okay, press against it, okay, excellent job. We're going to be doing it now. Tilt your head back against my head, okay, back against my head, okay, very good indeed, okay, tilt in against tilt your chin downwards against my head, okay, very good, absolutely marvellous job there, excellent job, I say. Right then, let's see. The next test that I have for you is called the smell test. I'm going to be using some artificial smells and I'm going to waft them under your nose and I want you to identify them for me. Please tell me what they smell like, okay? So one moment whilst I grab the bottle. Where is that bottle? Where is it? Okie dokie. Now then, I've got 3 bottles, 3 different smells for you to identify. Oh, absolutely marvellous. Okay, so I'm going to place this under your nose. If you could take a big sniff for me, please. Big sniff. Okay, what does that smell like? That smells like a nail varnish remover. Very good job, okay. Now, smell number 2, a different smell to the first one. Let's see what this one smells like, shall we? Wow, okay. Have a sniff of that. These are quite strong smells. They are artificial. Have a smell. Big sniff. Okay. Very good, well done. 3 out of 3 smells correctly identified. Olfactory nerves working perfectly. Good sign, good sign. Now then, the next test is a little bit similar. It's called the taste test. Okay, I'm sure you can work out what it is just from that name alone. Okay, I've got 3 tastes for you to taste. Okay, so if you could stick your tongue out for me, please. Stick your tongue out. Very good. Now I'm just going to put a little droplet on your tongue there, okay? Now, what do you think that one tastes like? What do you think it tastes like? Caramel. Very good, very good. Correctly identified. Caramel was taste number 1. Okay, very good. Is there a helicopter going over the office? Let's just wait for that to pass, shall we? Okay, now then, taste number 2. I'm gonna put a little droplet of that on your tongue for you. And could you please tell me what that tastes like? What does that one taste like? Coffee. Very good, correct. Correctly identified. Okay. Sounds like the helicopter's coming back. It's circling above our house, our office. Okay, so let's wait for that again. Okay, taste number 3. Taste number 3. Let me just put a little droplet of that on your tongue. If you could tell me please, what does that one taste like? Orange. Very good. Well done. Correctly identified all 3 flavors. Your taste nerves, taste buds, working fabulously well. Absolutely perfectly well. Okay, that's a good sign. Very good sign indeed. Now then, next, I'm going to be looking at your reflexes. And in order to do that, I'm going to tap your knees and I'm going to tap your elbows. Okay, you're probably familiar. I'm not going to be using the special tool that looks like a triangle today because I do not have the special tool that looks like a triangle on me. Okay, I'm going to be using my fingers. My fingers, they work just as well, pretty firm. My fingers, pretty strong. Okay, I'm going to be doing that on your knees. If you could move your leg, one knee over the other. Let me just position that for you, if that's okay. Yes, okay, very good. Okay, very good, very good. Now I'm just going to tap your knees. 3, 2, 1. Good. I'll do it again. Actually, 3, 2, 1. Good. Okay, now they could swap the knees over. Just like that. Absolutely perfect. Okay, here we go. 3, 2, 1. Very good. 3, 2, 1. Very good. Now, if you could drape, keep your arm loosey-goosey for me. Okay, loosey-goosey. Just relaxing, just like that. Excellent job. And I'm just going to tap the elbow, same as the knee. 3, 2, 1. Okay, 3, 2, 1. Excellent job. I'm going to do the other one now. Okay, so just keep this arm nice and loosey-goosey as well. Just like that. Absolutely perfect. Okay, 3, 2, 1. 3, 2, 1. Very good. Very good. Good reflexes. Good reflexes. Right. The next part of the cranial nerve exam that we're going to do, I want you to hold both your arms out like that for me, please. Okay, like a zombie, kind of zombie going for a walk. Right, I'm placing my hands either side on the outside of your arms. I want you to resist as I try to squeeze your arms closed. Okay, so resist. Okay, good. Now I'm placing my hands inside your arms, inside your hands, and I want you to squeeze my hands together. Okay, squeeze my hands together. Squeeze. Okay, very good. Very good, very strong. Okay, now raise your arms against my hands. I'm going to be applying some pressure, trying to stop you. Raise them. Go on. Yes, very good. Okay, now my hands going beneath your arms. Lower your arms against mine. Again, some pressure being applied. Okay, very good. Very good indeed. Good strength there. That's what I'm looking for. Let's see. I think it's time for me to examine your ears a little bit. Your ears. So just let me grab my otoscope for a moment. going to be sticking that in there. I'm just going to be observing. Good Lord. Good Lord. Your ears are quite dirty, aren't they? Ears are quite dirty. When was the last time you had your ears professionally cleaned? Never. Never. Good Lord. Okay. Let me just check this ear as well. Oh my goodness me. Oh my goodness me, they're filthy. You've got filthy ears. Lots of earwax buildup. That is simply unacceptable. Okay, what I'll do for you is I'll do it extremely quick clean. Okay, I don't have time to do a full professional ear clean, but I will do a very quick one for you, okay? So one moment. Now I'm just going to be cleaning this ear with my little cotton bud, okay? Now obviously, I'm a professional. So I don't want you to go home and shove a cotton bud in your ear, okay? Because it won't be the same as what I'm doing here, okay? I'm using a very advanced and a very professional technique. Okay, very advanced and professional technique. And if you do it, I'm probably just going to compact the earwax and shove it further into your ear canal, deep it in there, compact it and shove it further in. And that's the opposite of cleaning it. That's not what we want at all. In fact, that will cause problems. Okay. So don't do this at home. Don't do this at home. Allow me to do it for you. You should book an ear cleaning appointment with me, okay, in the future, so that I can do a proper, thorough, detailed ear cleaning for you, okay? Let me do the other ear now. Okay, so I'm just going to do this ear as well. Obviously, as I mentioned, this is just a very quick superficial, artificial one. Superficial. I do not have the time to do a full, detailed ear cleaning appointment with you. I'm sorry, I do not have the time, okay? I'm very busy. I'm a professional, medical professional. Okay. Almost done. Got quite a bit out actually. Quite a lot of progress has been made in quite a short period of time. It's actually quite good indeed. Quite good indeed. Okay, that's enough of that. Now then, I want you to repeat back to me the words that I whisper into your ears. Okay, this is going to test your hearing, very rudimentary, but it gets the job done. Enough for cranial nerve exam at the very least. Okay, so here we go. Coconut. What did I just say? Coconut. Coconut. Very good. Okay, let's go again. Technical. Testicle. No, I did not just say testicle. Okay, let's try that again, shall we? Maybe it's this ear specifically I have a problem with. Let's try that again. Technical. Technical. Correct. Technical. I did not say testicle. I said technical. Okay, very good. Right, well done. Okay, next word. Okay. Hippopotamus. What did I just say? Hippopotamus. Hippopotamus. Very good. Hippopotamus. Okay, very good. Next word. Head and Shoulders shampoo. What did I just say? Head and Shoulders shampoo. Okay, I think your hearing is good enough actually. I think that was just a little mishearing of the word, that one word that we did earlier. Let's not dwell on that too much, okay? Otherwise though, perfectly good score for the hearing. Okay, let me just write down a few notes. Okay, right, I think based on what I've you've seen today. You've actually performed very well indeed. Very well indeed. Every portion of the cranial nerve exam, I think you have passed with flying colours. Flying colours. So from my observations, you do not have any damage to your cranial nerves. Everything is performing in tip-top condition, tip-top shape, as I would expect it to be for a healthy individual. Okay, so my official statement for you is that you are healthy. Well done, congratulations, you are healthy. Okay. Now, after the appointment, once you've gone home, I'm just going to type up the notes that I'm doing here. These are just brief versions. I'll type up a more detailed report, and I will send that over to your GP. They may refer you to somebody else for some more testing, or they may be happy with the results, with the report that I send them today. And if that's the case, they will likely contact you, maybe by phone, maybe by email, text. I'm not sure how they do it these days. And they will tell you what to do next, maybe even nothing, if they think that you're nice and healthy, like I do. Okay, so thank you so much for coming in today. You did absolutely perfectly well. I'm very impressed with you. And yes, perhaps I'll see you again in the future. Nice one.